Hello, and thank you for attending our webinar, KPIs and Dashboards That Matter. I'm Brian Boji, and I lead the healthcare vertical for Sage Intech. We appreciate that you've taken time out of your day to watch, so I'll begin right away. First, let's cover a few housekeeping items. We want to make sure this session is as useful and helpful to you as possible. During the webinar, if you have any questions, please feel free to submit them in the Q&A panel, and we will address those at the end of the webinar. If we end up running out of time before we get to your questions, we will follow up with you afterwards to get your questions answered. For reference, we'll also be sending you a copy of this presentation and a recording of this webinar in a follow-up email after the event. I'd like to introduce and thank our guest speaker, Brian Gorek, Director of Accounting at Barrow Whole Health, for joining us today. Brian, please tell the audience a little bit about yourself and Barrow Whole Health's mission.
Perfect, will do. So as Brian did mention, my name is Brian Goldrick. I'm the Director of Accounting at Barrow Whole Health. My background, actually, I have done a lot of audit work, both in government as well as for-profit. I've also managed an accounting department for an insurance carrier. Most recently, I've started working with Barrow Whole Health and its mission with disrupting a broken system right now with the way healthcare is being provided across our nation and globally, really in general. We partner with customers or large and mid-sized employers to provide on-site, near-site health management, while also recently we have partnered with payers and are being coupled with some of the insurance plans that are being offered in those regions.
Fantastic, Brian. Thanks again for being here today. Today's agenda. Today we'll discuss healthcare industry trends. We'll talk about the changing role of healthcare finance professionals. Talk a little bit about how to be data-driven. You'll hear about the top 10 KPIs, and we'll discuss with Brian dashboards that matter. So when we look across industry trends, we're seeing a couple of things that stand out amongst the rest in this incredibly fast-paced changing healthcare environment. There's the move to the cloud, the need to be able to work from anywhere, the need to be able to have data and access in real time is driving a lot of companies to adopt new technologies. There's the growth through consolidation. As more and more practices come together to perform larger entities, some in the hundreds of entities, there's that continued growth and the need to understand and manage that growth. There's ongoing cost reduction initiatives. As reimbursement rates continue to decline, there's the need to look at the business from all sides, be smart with how you handle costs, and align those correctly with the business. There's evolving regulatory requirements. And we're not just talking about HIPAA, but there's also multi-state reporting requirements, Medicaid, Medicare reporting requirements, and privacy reporting requirements that are going to continue to change and evolve. And there's a shift to consumer-directed healthcare. As consumers pay more and more toward the cost of their care, and they have access to additional information via the web, they are becoming much more savvy consumers and are expecting a experience like they would with an Amazon or another type of online company. So Brian, are you seeing these same trends, and how have they affected Barrow Whole Health?
Absolutely seeing the same trends. For instance, with regards to moving to the cloud, Barrow right now is updating all of its systems for this very purpose. With Sage Intech specifically, I've been on PTO in Mexico, been able to log on, approve journal entries, get in and drive into my KPIs, view dashboards, see where we're at in real time. So that's been wonderful. Another thing, obviously, is reducing costs. That's big for your board of directors and any shareholders you might have. Another one is the shift to consumer-driven healthcare, which is essentially the main focus of Barrow and while we're here right now.
One of our partners, Renino, conducted a study. And really what the net of that study is that healthcare CFOs want to spend more time on strategic activities and less time on accounting tasks. And when you think about it, CFOs and accounting staff have spent 75% or more of their time as an accountant and a protector. and not as a strategic advisor to the organization. So what we're working toward and what we've seen is that the accounting suite, especially on the CFO side, really need to take the time to be that strategic advisor. And the goal is to be 50% or more strategic so that they are able to do and advise the business in such a way to help it grow and become that strategic advisor. So Brian, I'm sure your role has become more focused and more strategic. How has Sage Intacct helped you do that, and what about the other folks in the accounting suite as well?
Absolutely. So my CFO doesn't even have a login to our accounting system, Sage Intacct. Our Senior Director of Finance and Financial Planning and Analysis, she also does not have a login to our accounting system. I fully own and operate our accounting system, and then that allows my Senior Director as well as our CFO the ability to be more strategic, to drive into those KPIs. We actually used Armanino to build out Sage Intacct for us, actually. And so this really allows the CFO and the Senior Director of Finance really to dive in and figure out how we can manage costs to create a bigger return, and also looking at future contracts with customers, we're able to develop KPIs that help them determine what the pricing model should be based on the number of enrollees we might have at a particular clinic and the number of providers and staff that we need to have on site in order to get the return on the investment that we're looking for.
Those are some great examples, Brian, and I think as we start to look at it, there are really three things that finance leaders have to be able to take that data-driven approach. And it's automated financial operations, multidimensional analysis of key results, and synchronized data with other systems in real time. So Brian, tell us a little bit about how those areas mesh with what's going on currently and your future plans at Vero Whole Health.
Right now, our big reason for selecting Sage Intacct, and I've used this analysis before, is that we kind of viewed it as the wheel with all of these spokes coming off that would connect to different systems. So right now we currently have Concur and our budgeting system, Adaptive Insights, connected to Sage. And so from an automated financial operations perspective, we're able to see that in real time in both the Intacct system as well as our budgeting system, Adaptive Insights. We're able to analyze both systems in both systems, and then we're able to synchronize that data so that we can do the budget versus actual analysis within Adaptive, and it pulls in all of the actuals from Sage Intacct so that when we look at variances and we're trying to figure out what's actually happening with that particular account, we can drill in and see those detailed transactions that feed over from Sage Intacct.
Brian, you had talked about some of the KPIs and the fact that you're using us to track these things. And when we have interactions with our customers and prospects, we talk about what are some of the dashboards and KPIs that they use. And what's really interesting across, acute, ambulatory, post-acute organizations, we've kind of come up with our top 10 that we hear about regularly. And those are revenue per bed, revenue per clinician, revenue per treatment. You've got expense per bed, number of patients served, number of encounters, number of clinicians, aggregate R&E per practice area, P&L by location, P&L by actual budget. But these are some and not the only KPIs that are out there and that are being tracked. What are some of the KPIs that you're tracking from the way that you deliver healthcare?
Yeah, actually, a lot of these KPIs we do use, but they're more indicative of like a hospital. What we're looking at when we are building out dashboards and KPIs is we're looking at what is the clinic margin that each one of our clinics is operating at, and that helps drive and determine the rate that we're charging to our customers. Some of the things that we're taking a look at is we're looking at some of our operating costs by either number of eligible lives, for that particular clinic, how much of medical supplies are we using per clinic visit. We've also had the ability to track like what you have on there, P&L by location, as well as look at that actual budget versus actual and be able to drill it down to each one of our locations so that we can see which clinic is operating better than others and try to then drill in to figure out why that's the case, why one clinic is operating different than another.
So that's really interesting. The other interesting part of that is you've got to be able to send those reports and be able to view those reports quickly and customize those dashboard versions so that it's a push button. Is that something that you're taking advantage of as well?
Absolutely. I mean, we need to be real time because currently with Sage Intacct, I'm able to report out to my CFO immediately on clinic margin for a clinic that she inquires about. Whereas previously in our old accounting system that we're using, that ability would have taken a lot longer and we could have missed out on an opportunity. Whereas Sage Intacct allows us to make real-time decisions that help benefit the business immediately.
Here is an example of a dashboard with KPIs included. This one is specific to Management Insight. As you can see, revenue per bed, G&A expense, revenue for treatment, and net income are featured. As fantastic as that information is, you can also drill down to see exactly where those numbers come from. And you can gear these reports to the level and needs of the executive who is requesting them. For instance, this is a CFO daily view where it's showing net income, G&A expense, revenue per bed, and expense per bed as well. In this example, you can see you can also create a periodic review. You're able to also customize the views for immediate action. In this case, the view is for the business administrator. What's really key in order to understand your business is that real-time, multi-dimensional analysis of key results. So you can filter your data by any dimension to gain insight into your key results, and you can do it all in one place. As we've seen, you need to be able to tailor dashboards to any role in the company, by CFO, by controller, or even by non-finance business manager. And Brian alluded to this earlier when we talked about roles in the organization and the information that's key to their success. And this includes capturing all the financial and business metrics, and from a high level, being able to drill down to the detail to explore what's actually happening. That faster insight also happens when you collaborate with peers, especially ones who don't necessarily work in the same building as you. Brian gave a great example of doing some work on PTO and being able to do it from a remote location. And the ability to communicate with each other from those dashboards to get the context behind those numbers and not have to do this with emails and multiple phone calls. I'm sure that wouldn't have been fun while you were on PTO. So lastly, you need the ability to personalize ad hoc analysis yourself and not have to require IT services for every new dashboard or every new bit of information that you need created. Brian, tell us a little bit about what dimensions you're using to better understand the business.
Absolutely. So we have essentially 3 entities, and so I'm able to drill into each one of those entities. And then within each one of those entities, we have departments set up. And each one of those departments, whether they be our field supports or our support departments, which would be your finance, payroll, human resources, sales, and then we can also drill into the clinics, which are our operating departments, and be able to drill in and see in real time how each clinic is performing. So all of those various levels roll into what is called on the Sage Intacct the top level, which is essentially your consolidated business operations. So we're able to track it at the top level, and then we're able to drop into each individual company to be able to track it at each individual company, and then we're able to even drop in even further to drill in by the department.
You also need to ensure that you're achieving insight while still being HIPAA compliant. As you know, compliance with HIPAA, which stands for the Healthcare Insurance Portability and Accountability Act is crucial. You may wonder what health information would be stored in an accounting system, but there are such situations as billing, refunds, and reporting that might include procedural codes or could clearly identify the type of treatment a person was receiving, which is also considered PHI. Make sure your financial software has the ability to monitor PHI access, has a HIPAA certification, and is willing to sign a business associate agreement. Here are some examples of what our customers have been able to achieve. University Clinical Health was able to take away the mundane and put that time into being strategic. The results, they improved reporting and tracking. Accounts payable processes were dramatically streamlined. They fostered greater accountability and improved positive cash flow by $125,000. They've seen $500K savings annually with a 40% shorter monthly close, and 8 days a month were saved from automation and understanding the impact of KPIs and their dashboards. Bay County Medical Care Facility put that focus into cost control. The results after: reduced spending by 5 to 7% through improved visibility and accountability, improved reporting accuracy by 70%. Monthly close was shortened from 3 weeks to 1 day, and the software paid for itself in about 5 months. That's a 90% shorter monthly close cycle, 50% improvement in gross margins, and a 50% increase in overall productivity. So Verihole Health got insight into optimal staffing levels, as well as some other great results by moving over to Sage Intacct. Brian, tell us a little bit about your experience.
With Sage Intacct, it's been like night and day from our previous accounting system. The ability to log in and be able to view all of my companies right there is wonderful. Previously, I had to log out and log back into each company in order to be able to see what the activity and what was going on. And on top of that, my staff would have to log in because we would be doing journal entries in all three of our subsidiaries. So from that, it's freed up a ton of time on my staff's part. Specifically, we've been able to drop our monthly close from about 13 to 15 days down to about 4 or 5 right now. On top of that, like I spoke about earlier, I'm able to provide our executive group responses to any financial questions they might have in real time. What used to take days is I'm able to provide now within minutes.
That's fantastic, Brian. You had mentioned earlier approving some journal entries while you're on PTO. Not always fun, but often necessary. So tell us a little bit about how Sage has also helped you enjoy more nights and weekends.
Absolutely. We allow staff to work their own hours as long as they're getting their jobs done, which is great. And then that allows me to be able to do the same thing. But what that does require is that you're using a system that you can access remotely. So with Sage Intacct, like I mentioned earlier, I'm able to review stuff anywhere. I just have to log on to the website and I can do my work. And I can provide that information at any point in time to our executive group.
Excellent. So Brian, we've got a couple of questions that have come over from the audience, and we've got time for a couple of those. So one question that came in: what are the 2 most important KPIs that you're tracking?
A big KPIs for us is our operating expenses. And so like I mentioned earlier, we have set up statistical accounts where we're able to document the number of providers that we have at a clinic and the number of enrollees. So for instance, one of the KPIs that I track is our medical spend by enrollee, as well as our medical spend by clinician or practitioner that we have at each one of our clinics. And that helps us take a look at analyzing what the usage is, why is it higher than expected, and then we can actually go back to the clinic to say, hey, what's happening here? Why are your expenses so much higher than what they should be based off of, clinic data that we have gathered over the last couple of years with regards to our operating spend.
That's interesting and actionable. So you're not just seeing the data, but you're able to take advantage of that information. Okay. So next question comes in. You had talked about the reporting and being able to set up specific dashboards for folks. So what information does the CFO want at their fingertips?
Biggest thing for my CFO is taking a look at our clinic margin. That helps drive our pricing for each one of our contracts when we go out to new customers. When we're presenting to potential customers, we need to have that information in order to present properly what the actual expense is going to be for each one of the customers or potential customers that we have. So being able to dig into that information and see that in real time is crucial to the CFO, whereas previously that information was not available readily.
Excellent. So we talked a little bit about on your case study slide some of the efficiency gains that you've seen. Can you tell us a little bit more about those efficiency gains?
I would say the biggest efficiency gain that I have seen since moving over to Sage Intacct is in my staff's work. Like I mentioned earlier, our month-end process would be 13 to 15 days, and we've been able to do it in 4 or 5. That's 10 extra days that I have 5 people that are freed up to be able to do analyzing, reporting out to our various departments, and digging into what's actually driving these expenses and driving the KPIs.
That's really strategic, and as we talked about earlier in the conversation, a big shift from just reporting on, but having the time to dig in and really understand what those numbers mean.
Absolutely.
Are you interested in learning more? You can try Sage Intacct with a free 30-day trial. Attend an upcoming webinar. Read more about Verihole Health. Follow us on Twitter. Connect with Sage Intacct or give us a call at 877-437-7765. Thank you for taking the time to watch today's webinar. Questions we were unable to get to will be answered via email shortly. As a reminder, we'll be emailing a copy of the PowerPoint along with a recording of today's webinar to all attendees. We very much appreciate your time and interest. Thank you very much for attending.